You're listening to America'sWebRadio.com, the pioneer and leader in chat radio. Thank you for listening.
Hey, welcome back to Healthcare Consumerism Radio. This is Doug Field and Ron Bachman, your co-hosts of the program. We've got an exciting segment coming up. Benefit education and communication is actually paramount for successful participation and engagement with their employees and their families. And a firm that does it really well and makes it fun and interactive is Jellyvision. And joining us today is David Daskal with Jellyvision. Hey, David.
Hey, thanks so much for having me.
Yeah, welcome. Good to have you on here. And I should tell our audience that if you go to the Institute, you'll get a chance to meet Alex as well, right, David?
That's absolutely true, yes. You can get a little sample.
Yeah. David, talk to us a little bit about Jellyvision Lab, what you guys are doing, and highlight, this current webinar that's coming up as well.
Sure. Well, Jellyvision Lab, we have a couple parts of our company. The part that I sort of concentrate on most is our benefits communication tool, Alex, that basically kind of makes it feel like there's a person just behind the computer screen talking to each employee about their benefits. We also have a custom side of the company that does all kinds of work for various companies. We do onboarding work. We do kinds of targeted marketing. All of it kind of growing out of the history of the company. We actually started as a game company, and we make a game called You Don't Know Jack. So the technology for all of these corporate conversations comes out of that game that we actually still make.
Yeah, Harry is a real character. Harry Gottlieb is the chairman and founder of Jellyvision, and he's a real character, and he does it well. And you can actually see Harry at Forum East coming up in Atlanta.
That's right. Yes, we were there last year. He had really great attendance at his event, and I think the people who came really got a lot out of it as far as learning about sort of tips for benefits communication.
Yeah, they did. David, talk a little bit about what you see from your seat in working with your various clients of why benefit communication is so really very, very important right now.
Sure. I think I'd like to sort of flip that around and talk about what's wrong with bad benefits communication, because the answer to that is really a lot. Bad benefits communication leads to bad benefit choices by employees, and then, companies spend tons of money trying to get employees to understand basic benefits concepts with kind of very little to show for it. They get bogged down with questions from their employees. They waste a lot of time on issues that really could have been resolved earlier if the benefits materials themselves had just done a little better job. So, I think in addition, you probably know, there are a bunch of new studies out there showing that employees are more likely to leave a company if they don't feel like they really understand their benefits. There's actually a 2012 AFLAC report showing that employees are twice as likely to leave their jobs when they believe their HR departments don't communicate enough about company benefits. So that turnover cost is a real cost of bad benefits communication. So I guess to get back to your original question, good benefits communication is important because it saves companies time, money, and it ensures that their employees better appreciate their employers and their jobs.
David, this is Ron Bachman. Following up on that a little bit, with all this confusion, which we actually went through in our first section about compliance and complications of all the regulations and all the changes with the Affordable Care Act, when you're going through that kind of confusion in the marketplace, I believe that doing something that actually has some fun in it, something that is enjoyable in this whole process, the confusion and stress and strain of the whole system. Your system is kind of fun. That's what I like a lot about it. Tell us about how it's different, because you're coming out of the gaming background that may reach younger people who may not be as knowledgeable about healthcare benefits because they haven't had it for so long. Some people who've had benefits for 10, 20 years, they understand some of the differences that are being implemented. But tell the audience a little bit more than any other communications program that might be out there, or any other vendor that does communications. They could say some of the same things you've just said, but you really approach it from a different perspective. Tell us about that.
Sure. As you said, we really come out of this from the games perspective. So that is, fun is a really important aspect to it. And especially when you're talking about something like benefits communication, honestly, it's not the most interesting subject out there.
Right.
It can be really boring. So to be able to bring some humor and some lightness to a subject that usually employees approach with a sense of drudgery is an important part of what we do. When each employee starts a conversation with Alex, it really does make you feel like you're having a one-on-one conversation with an engaging, kind of interesting benefits professional. And so that in and of itself, it really sets us apart from other benefits communication tools. The employees actually interact with Alex in a way that gets them personalized plan recommendations and benefits education that's relevant to their own needs. So that is kind of the fact that we are taking benefits communication and giving it a fun, engaging way to be communicated, I think really sets us apart in the marketplace. And we do this in a way that is really easy to implement. We can work with any enrollment system. We fully host it, so there's very little tech burden to the company. Just to give you a sense of this fun, as part of our usual analytics, we collect verbatim employee comments every year from our companies. And every year, without fail, we get people proposing marriage to Alex in these comments. And I don't think you can say that about any other benefits communication tool. And it really testifies to how fun he is to use. But, really, honestly, I don't think people would use it unless we've proven that we can save companies time and money. So as far as the bottom line goes, we save companies time and money. So it's just not another cool toy. Right. It actually works.
So in this whole process, there's a lot of different important learning moments for an employee to figure out not just what's in a benefit package, but the front end, how to choose a benefit package, how to use a benefit package after they've selected one and maybe understood some of the benefits at enrollment, but then they have a claim, or down the road other changes on choices. Maybe even understanding illnesses. How extensive are your current programs, and or where are you going with some of your communication tools like this?
Well, we really help them at the initial stage of choosing a plan and helping them understand what their benefits suite is. Further down the line, issues about claims, that kind of thing, those are handled by the HR people at their company. But as far as what we see becoming more critical, obviously, as you guys were talking about earlier, healthcare reform, everyone is talking about that. And to a slightly lesser extent, but still very important, wellness as well. Just like probably every HR person listening, every company listening, our clients are concerned about delivering messages that are going to be required by this new healthcare law in a way that employees can understand and in a way that they're actually going to listen to, as well as just providing some kind of general guidance about how these changes are going to affect those employees most directly. So Jellyvision actually has developed a new Alex tool to address these communication pain points, and the tool is designed to give the employees the information they need in a timely fashion and in a way that's going to keep them both entertained and engaged, as our current Alex tool does. We also have a wellness program in the works. More and more companies are putting in wellness plans, but are there employees participating? Maybe, maybe not, but certainly probably not as much as the company would like. If they are participating, often there's grumbling about the requirements. Mm-hmm. Again, a big part of the problem here is communication. Right. Good communication will help motivate those employees to take the first step in improving their health. And our tool really does that. It explains the results of a healthcare screening, for example, in a way that employees can understand, and it helps match employees with programs and resources so that they can take the first step. Once they do that, there's there's a much better chance that they will sort of be willing to make the meaningful changes in their lives that those programs are designed to help them achieve.
So for our audience out there, who's your market? Who do you sell to? Is it an employer who would approach you about customizing something for their program? Are you selling to insurance carriers, third-party administrators, all the above? Where's your client base? And for our listeners out there that might be interested in this.
Well, of course, we will talk to anyone who is interested in implementing Alex. I'd say for the most part, we sell directly and mostly to employers with 2,000 employees and above. We also are interested in working with employers with between maybe 1,000 and 2,000. For some of those companies, especially companies with lots of locations, we can save a lot of time and money over their current communication efforts.
Are you focused geographically? I'm sorry.
We're really nationwide. We don't really do international, but all over the country.
That's good. Hey, David, take a minute. We got about 3 minutes left on the program. I want to give you an opportunity to talk a little bit more specifically about your upcoming webinar and the subject matter which you're going to be talking about.
Sure. We're going to be the name of the webinar is Beating Benefits Bewilderment, and basically we're going to be offering some very simple tips that companies of all sizes can use to improve their benefits communication. Just to give you an example, we get asked, what's an example of something that we can do at little or no cost to help us communicate better? We kind of have a simple rule of thumb. Do a quick audit of your current communications and ask this question. Are your materials written so that a 7th grader will understand them? Seriously, just look at them from the perspective of a 7th grader. If your answer to that question is no, then you need to put a little work in. Health insurance and other benefits communication are often really complicated, and they're confusing. They're full of jargon, and they're full of the kinds of stuff that HR people understand, but not their employees. So we'll be offering tips like that, simple steps that you can take to simplify your communications and make sure your employees understand them better.
And you'll have one of your clients, Ministry Healthcare, along with you, correct?
That's correct. We will have Ministry Health. One of our clients will come in and speak about their experience with Alex. For example, when they used us, their HSA enrollment was twice what they projected. 96% of their employees thought that the education Alex provided around HSAs was helpful. And they had great participation rates, mostly based on excellent word of mouth among their employees. So Ministry Health will be with us to talk a little bit about some real-world experience using the tool.
Well, David, time flies when we're having fun now. Our audience, you can register for this webinar, which will be April 11th at 2 o'clock, and you can register at the IHCC site. And as I said earlier, you can also join us at IHC Forum East, where Jellyvision will be hosting a workshop and be talking about a lot of this. And David, I really thank you for joining us. These segments run fast, but it's very, very informative, and I look forward to seeing you soon in Atlanta, hopefully. And again, thanks for joining us on Healthcare Consumerism Radio. And to our audience, stay tuned for our next segment with Rick Joyner at eFlex Group. Thank you.
Thanks so much.
A public service announcement. Are your employees suffering from benefits bewilderment? Symptoms can include nightmares about enrollment season, nausea when presented with a deductible, and cold sweats at hearing the phrase, consumer-directed health plan. If you're looking for a cure, join me, David Daskal from the Jellyvision Lab at 2 p.m. Eastern on April 11th for my presentation, Beating Benefits Bewilderment. Together with our client Ministry Healthcare, we'll share simple tips and real-world examples that will help you spread the good word about your company's benefits. You'll learn to squash enrollment confusion, save time and money, and win the beaming admiration of your boss. To learn more, check out the Institute for Healthcare Consumerism's website at www.theihcc.com. This has been a public service announcement of the Jellyvision Lab, www.meetalex.com.